After some in-depth data analysis, the Suicide Prevention Coalition around the community where I live in Columbus, Ohio, has identified that the highest risk population group for suicide is white, mostly middle-aged men dying by firearm. So in our community right now, there's not a lot of sympathy for white middle-aged men. And in fact, being a member of that group, some people would like to see a little thinning out of that population. So it's not real, no, I mean that somewhat facetiously, but somewhat seriously too. And the reason I say that is there's not sympathy for identifying that target population. So what we're looking more at in order to reduce the incidence of suicide is means, and that has to do with firearms. So if you were tasked with trying to address that in our community, where would you start and how would you go about doing that?
The cover of The Economist last week, the story was global suicide rate is declining. Took a picture of it, and I used my little Photoshop-y app on my phone to draw in an upward line with an arrow and wrote in, but in the US it's increasing. So we know that. Over the last couple of decades, suicide rates have increased in the US. Meanwhile, around the world, they're decreasing. One of the main facts, obviously a lot of places had some catching up to do in terms of personal freedom, health treatment in general, right, especially in the third world. So new freedoms for like women in China was cited as a reason why there's fewer suicides in China. Homosexuality being more accepted all across the world, and even in some places in the Middle East, cited as a reason for fewer suicides in other places in the world. Meanwhile, in the US, we've got this population of disenfranchised people who are suffering with the fear-mongering and the division in politics and all the stuff that's going on, that feel hopeless and, again, disenfranchised and powerless. And it's a lot of the people in the rural communities, a lot of middle-aged white men, that also may be firearms owners. There's obviously an overlap there. So I think outreach and ending the stigma and making it okay as a middle-aged white guy to ask for help, even though you're supposed to be privileged or you're supposed to be okay or whatever, because it's not in the news. It's not a demographic that gets a lot of sympathy, as you said, right? I don't know if there's a lot of antagonism necessarily, but there isn't enough outreach, there isn't enough empowerment for asking for help. So that's one of the things we're trying to do. And I mean, Mike has been really active in that.
Yeah, just one thing that I think everyone should know. So I own a firearms business. Basically what I do is I import firearms into the United States from all over the world. I have a line from Argentina, I have a line from Slovakia, I have a line from the Philippines. I'm considered one of the smaller guys in the industry, and I bring in 60 to 80,000 firearms a year. That can kind of give you a perspective of how many firearms are out there. Guys like Glock, guys like Ruger, guys like Smith & Wesson, they all sell over 1 million. This is a year, in 1 year. So I like to always kind of put that in perspective when we're having these conversations, especially like when I'm sitting and talking to somebody at a bar, because most of the time people are pretty blown away when they think about it like that. But you know, back to your point, and one of the reasons why I kind of love what Walk the Talk America is doing and the support I've been getting from my friends and my peers and from all walks of life, right? People that are not in the industry, is I feel like if we can go after some of the things that don't deal with legislation, we don't have to make it about legislation. Like most people are law-abiding citizens, right? We kind of let it fall where we deal with it. But we can literally get to the youth. Like Dr. Jeffrey Swanson from Duke University, another guy I emailed who responded, which was awesome. I had a 2-hour conversation with him. He uses that term, get upstream to prevent the unpredictable. I love that term. Like I fell in love with that term because it's, you know, a couple of the initiatives we have are literally going after youth, starting this early. Like one of the things we're doing is the Walk the Talk America band that's linked to the screening, the MHA screening.
We didn't mention that, Mike, that we have formed an alliance, and Walk the Talk America is using Mental Health America's screening. And we hope that this will help folks feel more comfortable to identify when they're having something going on, because folks know it. Information about it, and we'll give you more information about it. But we are talking about our continued shared interest in reducing suicide, and we will all be working together, Walk the Talk America and Mental Health America, in creating a certification for gun shop owners to identify folks who are suicidal and to help bring that rate down. So we're really working together to do them. I'll let John have the last question. We'll break for lunch and these guys will talk to you more.
Thank you, Debbie. I appreciate it. My name is John Scott. I work at Mental Health America of Northeast Florida. My question is going to pertain to Parkland. And, if you look specifically at the details associated with Nicholas Cruz when he committed those atrocious acts on February 14th, the record was a mile long insofar as people trying to notify law enforcement. The FBI had 2 tips. Broward County Sheriff's Office came out there more than a dozen times. You had friends and neighbors that were, or at least neighbors that were very concerned about what was happening. You had the Department of Children and Families expressing their concerns. You had the schools expressing their concerns. Nicholas Cruz himself called 911 and made a plea for help days after his mother died. None of this stopped him from buying a gun. So my question is, what types of evidence and what is the recourse for this type of hearing to be held to stop an individual from buying guns?
Yeah, Parkland is like a series of tragedies, and I technically live in St. Augustine, but I'm never there, so you must be somewhere near me. That's all. That was February 14th. I was driving down to Dallas the whole time that Parkland was happening, out of communications. When I got back into cell service, my phone lights up. I teach active shooter response. I started a program called the School Attacker Response Course when I was living in Columbus, Ohio in 2013, right after Sandy Hook. I'm a co-owner in a CrossFit gym, personal defense, unarmed defense physical training center in Hilliard, Ohio. And Aaron Giannetti, my co-owner there, just wrote a book on surviving an active killer, but like I'm embedded in this world. I had 2 really important texts. Actually, 1 Facebook message and 1 text. 1 text was from a guy who's also become a friend of Mike's now. Screenshot from his daughter who was hiding in a closet at the school. Gun rights advocate, podcaster, videocaster, had the rifle in his car, gets the text. There's a shooting going on. I'm hiding in a closet. In the drama, a lot of people have paid attention to this drama club there. She's in the drama club. Her sister was also hiding in a closet on the campus. The other Facebook message I got was from the Coral Springs Police Department, one of the training sergeants from Coral Springs Police Department. As everybody who's paying attention to this knows, Broward County's gotten a lot of flack for not making entry, responding immediately to school. Coral Springs was actually the first responders, and I got a text from a sergeant there who's been a student of mine who passes on. I run, as I said, an educational company that teaches this stuff, saying, your material saved lives today. I have one friend whose kids were almost killed, and another police officer thanking me for the work that we do. And we live in this world. So the Parkland, and then I'm wearing a medical kit. This isn't a gun, everybody saw this. I'm wearing a medical kit with tourniquet and compression bandage and chest seals and all this stuff on my ankle. We had 3 of our instructors happen to be at the concert in the Las Vegas shooting, where Mike lives in Vegas. One of them got shot in his cell phone. One of the people they were with took a bullet in the leg. They provided medical attention, pulled people out. But we get these texts. We live in this world. We ask the same questions you're asking. As a law enforcement guy, I carry a badge, right? I'm a reserve officer still in Colorado. I can't tell you why they didn't do the right thing. I can tell you there's politics involved. I can tell you there's a cover-up. I can tell you there's scandal. I can tell you there's a container full of metal detectors sitting on the premises of the school right now in Parkland that they started to install 3 days before the school year started, but they didn't like the negative image of metal detectors at the school, so they left them in the container. The school board reversed their decision. The clear backpacks you heard about, clear backpacks lasted for like a month. I got a screenshot I saw on Instagram by our friend Kevin, who wrote a book, by the way, about his experiences as a pro-gun guy living in Parkland for the last 6 months. It's an ebook. It's coming out in hardcover or physical form just after 1st of January. The screen message that he put up on Instagram this morning was, monthly they're doing almost meaningless drills. You talk about trauma mitigation is something that Walk the Talk America's big about. It's another overlap we have with Mental Health America. They're causing so much, I believe, damage with these almost worthless monthly drills they're doing, and that's part of Kevin's message. His kids, his 2 daughters, still deal with this monthly. When those alarms go off, they're reminded of the trauma, and they have no infrastructure to actually help these kids. The first month or two, everybody's there, the news is talking to them, everything's on, we're going to help you through this, we're going to be there for you. The community's doing nothing. So what do? We raise awareness. What do? We call out the Broward County Sheriff's Office. What do? We ask the questions about why the red flag laws don't exist the right way to force action. And I'm asking the same things about Thousand Oaks in California last month, right? How did that not go the right way? Mike can talk a little bit about his experience with the 5150 issue, but they didn't even cite the red flag laws that have existed in California. Why didn't they use them instead of the 5150 emergency commitment, the involuntary commitment? Why didn't they go for just take the gun away instead of involuntary commitment? And then that comes back to, if you do the take the gun away or you do the involuntary commitment, how does that get reported into the NICS so the guy can't legally buy the guns 2 months later, 3 months later? It's a mess. These conversations are what's going to fix it.